Hello everyone, my name is Perlita Moreno and my career path is clinical laboratory scientist. So a clinical laboratory scientist is a person that works with a microscope to analyze blood, saliva, and urine samples. To work in this field, you have to be well educated on the human body to determine whether or not the sample received is normal or abnormal. The policy that I will be talking about today is the Clinical Laboratory Improvement Act of 1988. The Clinical Laboratory Improvement Act of 1988 is an act that says that anyone that works in a laboratory and has access to human specimens must have a certification to perform low-risk tests called wave tests and complex level tests called non-wave tests. The FDA is in charge of regulating the non-waved and wave tests. The FDA considers wave tests to be low risk, which causes these tests to be more popular among laboratories, hospitals, and doctors' offices. So, what is considered to be an approved wave test? To name a few: dipstick urinalysis, urinary pregnancy test, Accustat drugs of abuse home test, fecal occult blood, whole blood glucose, hemoglobin, ovulation tests, partial thromboplastin time, and many others. So, what are the issues involved with wave tests? One of the issues is that the patient can feel frustrated. Although wave tests are low risk, there is still some risk involved to the test, meaning that there is a possibility that there could be a misdiagnosis. If there is a misdiagnosis, the patient can feel frustrated if the doctor tells the patient that they are diagnosed with something, and then they get retested, and then it ends up being an inaccurate test result. Another issue is that there aren't any strict guidelines on the wave testing. If you look at the non-wave section, non-wave has more requirements, such as more years of experience and more frequently updated certifications. Meanwhile, the wave test doesn't have much requirements for the certifications, and there isn't a regulated routine inspection in place. So, how can we improve the Clinical Laboratory Improvement Act of 1988? There should be more frequent routine inspections in place, more experience requirements, such as training and education, and also increasing the price of the wave test. Increasing the price of the wave test can cause a decrease in the wave test overall. Because these tests are quite affordable, they are at a high demand. So increasing the price will decrease the amount available to the laboratories. Why is it important to improve the Clinical Laboratory Act of 1988? It is important to improve this act because it is necessary to have more regulation, which will decrease the amount of misdiagnosis and will keep the laboratory running more efficiently.